Hello everyone, my name is Kylie Markham. I'm going to be presenting my healthcare topic that I wrote about in my research paper. For the topic of it, I chose infant mortality. So I just want to start by telling you guys a little bit why I chose infant mortality and why it was so prevalent to me and why I felt the need to shine a light on it and discuss kind of what's happening in our nation with infant mortality. So my sister-in-law experienced infant mortality with a preterm birth at 14 weeks. And so that kind of opened my eyes a few years ago that there was an ongoing issue and that people are experiencing it more commonly than we would ever believe. So that kind of sparked my interest way back when. But then when I started looking at the research and things and seeing posts on social media about infant mortality, or just like the programs that are involved in our state, it really made me want to deep dive into it a little bit. And then finally, I've had about 5 years of experience in childcare and studying early childhood education. And because of that, I've always had a heart for kids, and especially those in like the early intervention age of like 0 to 3. I think that is a really vulnerable population, and it is, based on our textbook. But I think that is a population that deserves a lot more attention than what they are getting. So infant mortality is described as the death of an infant before the age of 1. And a lot of the research that I've seen said that a key indicator of how a country is doing in social progress, the well-being, and the overall health of a country can be depicted from infant mortality rates. And right now, as of 2022, the United States is sitting at 5.6 deaths for every 1,000 live births, which has actually went up from 5, an average of 5 from 2020. So we are up 0.6%, and a lot of the initiatives in the legislation right now is going towards lowering that number. There are 5 major causes of infant mortality in the United States that we're seeing. One of them being preterm birth, so anything before 37 weeks. Sudden infant death syndrome is a big one, especially in lower income areas. It's one of the highest rating causes of infant death, and that is the unexplained death of an infant. It's typically called crib death, a lot of people will call it, because it happens in a crib. And it essentially happens from suffocation of unsafe sleeping environments. The third one would be low birth weight, so underdeveloped lungs or other organs that aren't developing to where they need to be, causing that sudden infant death syndrome to kind of kick in or be more evident in that family. Unintentional injuries, those can be like car crashes or just like other accidents that could happen to the child. And then maternal health conditions. So those are the 5 that are most prevalent for the reasons why, or the causes of infant mortality. As I had said a little bit earlier, it has been determined that infant mortality is more likely to happen in lower income and rural communities and in ethnic and racial minority groups. So they've recognized these groups because of the inequitable cost, access, and quality of healthcare in those areas and in those populations. So a lot of my research came from our textbook, and I was able to look at chapter 11, which talks about vulnerable populations, and both low income and ethnic minorities are a part of the vulnerability framework. So for low income groups, we see that they're a part of the vulnerability framework because of their predispositions to being vulnerable, such as poverty, long distances to healthcare, the geographic density of the areas, weather conditions, lack of transportation, and being uninsured, which is, ties into another group of the vulnerability framework, which is the uninsured, which all of that is impacted by the cost, access, and quality of healthcare. All those factors play an important role in infant mortality due to the limited access of healthcare because of the location, the insurance issues, and the ability to attend prenatal. On the other side of my research paper, I wanted to look at the racial minorities and how they're impacted by infant mortality. A lot of my research that I found had stated, the low income and the racial minorities were the two groups that are experiencing it a little bit higher than the rest. In the minority groups, especially in Kentucky, we're actually seeing a rate 3 times higher in African American populations versus in like Caucasian and Asian populations. Because there's an inequity of healthcare available to them, and the cost of healthcare is so expensive, leading to a lot of that population being uninsured as well. I also just want to talk about the legislation that is specifically going on in the state of Kentucky. We have 2 different programs that really stood out to me when I was doing my research. It is the Sleep Safe Kentucky, and I've talked about that a little bit, but it's more targeted toward the areas in Kentucky who are more predisposed to infant mortality. And so, like I had said in the beginning, the low income areas, we're seeing a lot more. There's a map that I found on our Kentucky official government website where they're showing by county where the highest numbers of infant mortality are, and the Pulaski County area that I'm from is actually one of the highest. I'm pretty sure it's between 6 and 8 deaths per 1,000, so higher than the national average. And then there's another program called Healthy Start where they give low-income families a better start to make sure that they have a healthy family and child. And a lot of the government programs that we see is like WIC, and making sure those families have what they need economically, socially, and physically in their hands to ensure that they have a safe baby. As I stated previously, current legislation is focusing on advocating and pushing for the programs like the Sleep Safe program that I talk about in my paper. And that is just a way to give parents resources and ideas of how to help their child sleep safely and prevent SIDS. As I talked about earlier in this presentation, SIDS is the highest ranked cause for infant mortality, and the best practices that they have seen to change that are to change the way the baby sleeps and how we look at sleep for an infant. So my proposed intervention for infant mortality was to utilize allied health services to provide community-based and individual supports for families who are predisposed to infant mortality. We can use a home health system or an outpatient system to host community groups, go into the homes, teach these families about what can cause infant mortality and how to prevent it from happening to them. I believe that working with these families one-on-one will be way more beneficial than just posting on social media. One of the articles I discussed in my paper was looking at how the Sleep Safe program was pushed through social media, and while there was a decline in that, I do believe, and it is proven, that one-on-one intervention or even face-to-face intervention is more beneficial for clients and for families all around. And then the second part of my intervention was to collaborate with doctors and other facilities in the community that have that one-on-one interaction with the families to identify possible risk for infant mortality and focus on providing services to adapt the environment and give them the resources that they need in order to prevent or lessen the likelihood of infant mortality happening in their home. I hope this presentation was helpful to you all. If you have any questions, please feel free to reach out, but thank you all for listening.